and welcome to the GoLIVE Health Foundation Women at Health webinar series. Thank you to all the sponsors of the series. Today's episode is brought to you by our friends at Vitality. We would like to remind you that the Q&A feature is available, so feel free to send in your questions throughout the discussion. And with that, I will turn it over to our moderator who joins us from Vitality, Tanya Little.
Hello, and welcome to our Healthy is Hard webinar. Today's conversation couldn't be more timely. Many of you may have read the same article I did in Bloomberg this morning entitled, "It's Getting Harder to be a Woman in America. The US welcomes the employment and economic advancement of women, yet doesn't actually support them." The article talks to failed bills on paid family leave and extended Medicaid coverage for postpartum mothers, the overturning of Roe versus Wade, hate crimes against women, and women's health more broadly. So today we are going to talk about women's health, and specifically the creation of equitable health benefits for women. You carved time out of your busy schedule to attend this webinar, so I don't think I need to convince you of the importance of this topic. But suffice to say, we're delighted you've joined us, and we look forward to an insightful conversation. I am Tanya Little, Chief Commercial Officer at Vitality. And if you were to ask my eldest daughter of 8 what I do at work, she would tell you I make people healthier. For those of you who don't know Vitality, this is verbatim our core organizational purpose. We're the leader in driving engagement and healthy behaviors to reduce healthcare costs for corporates and payers. So we were actually birthed by a health plan, and we blend tech, data, incentives, and behavioral science to motivate population health. So at this point, I'd like to turn to my fellow panelists and ask them to introduce themselves to you because they will always do a better job than I would. I'm going to walk from right to left on my screen. So Katie, can we kick off with you?
Happy to. Hi, everyone, and thank you for joining. I am Katie Masada. I am the U.S. Benefits Manager at Moderna. I manage their benefits policies as well as their core benefits for our U.S.-based employees. Prior to that, I was actually consulting with Moderna for 5 years. So I've actually seen Moderna grow from the 200 employee company to the organization that it is today, which is all very exciting. But I'm looking forward to this conversation with you, Tanya, Sarah, and Scott. So thank you all again for joining.
Thank you, Katie. Scott, you're up.
Hi, I'm Scott Liebman. I started a company called Benefit Bump after spending my career mostly in benefits consulting, working primarily with large and mid-sized employers, and really excited to be part of the conversation.
Thank you. And Sarah?
I'm Sarah Rothstein. I'm the VP for Planning and Performance at Mass General Brigham and oversee our strategy for our value-based contracts there to create more value for patients, providers, and the healthcare system. Prior to that, I spent 5 years running a self-insured health plan where I led a number of projects to improve quality, including first of the kind in its nation, that created a high-value maternity network for our plan participants. Prior to that, I was part of the team that stood up Obamacare in New York, which increased access to healthcare, which is insurance, which is paramount for women. It's a pleasure to be with you all today.
You can see we brought you a great panel. I'm delighted to be here with these people. Thank you so much to all three of you for agreeing to join me for today's conversation. So why are we here? We're here because women make up more than half of the American workforce, and yet the significant chunk of the working population has suffered disproportionately since the pandemic. This is no news to any of you. Because women spend so much time and are integral to the workplace, we know that employers have a unique opportunity to optimize their health and productivity. And also, given the role that women typically play in household healthcare decision-making, this then has a significant impact on families and societies more broadly. And hence, drawing this panel together today and focusing the conversations on equity and on benefits. So kicking us off, if we look at what happened to women since the pandemic from a health and well-being perspective, we see some pretty disturbing trends. You'll probably be aware that Lean In told us that 1 in 4 women previously said they'd considered downshifting their careers or leaving the workforce. Now this is 1 in 3. McKinsey research shows that mothers are far more likely than fathers to be struggling with mental health concerns. And interestingly, what I did want to share is in Vitality's own data, we see these stats play out. So we saw 15% of women had moderate to high mental health risk scores at the beginning of the global lockdown. This is now over 20%. Compared to men who've remained stable at around 10%. So in other words, twice as many women are now struggling or at risk of mental health issues versus men. Also, we see other health disparities, and we know that these health disparities are linked. So across the board with our members, we saw a 28% drop in physical activity during COVID lockdowns. But what we saw is women were struggling to sustain their activity levels far more than men, with women recording 32% less fitness points. So this starts to tell us a story about what is going on for women and their health, and what needs to be done in that domain. So Katie, I wondered if we could kick off with you. If you can share what happened to women's health, maybe even versus men's health, but in terms of your employee base during COVID, and then a little bit of how is that shifting now, or is it even shifting now?
Yeah, and I think, as many employers realized, the burden was primarily on women during COVID, as often they're the primary caregivers. So what we tried to do is try to provide as many resources and supportive areas as possible for them. So we did things like pop-up daycares. We provided behavioral health solutions for mindfulness to kind of make sure that they were taking care of themselves as well. But I think one of the most unique benefits that we offer is the fact that our eligibility threshold is 20 hours versus the standard 30 or 40 that you see in other organizations. And so with that, we were kind of encouraging our employees, especially our female employees, if work was permitting with their bosses, to kind of utilize that and maybe take a step back, reduce their hours, knowing that it wouldn't have an impact on them financially or from a benefits perspective. But it's certainly an ongoing process for us. We're always looking for resources and making sure that we're listening to our employees to offer the benefits and the solutions that would be the most meaningful for them.
And Katie, in terms of uptake, it'd be interesting to know what that looked like. I mean, did you see people responding and engaging with those solutions?
We did. We saw that a lot of employees were having conversation with their managers or HR business partners about how potentially Moderna could support them through childcare needs or through children who were at home. A lot of the things we saw too were around needs for at-home schooling. So we offered a tutoring benefit as well. So a lot more conversations around those more holistic solutions were being had, which was great, as it was kind of driving our overall benefits and well-being philosophy in a really meaningful way, not only for COVID and the unique situation we were in, but also long-term as well.
That's very helpful. And we're going to circle back to this idea of benefits as broader than, they're not narrow. So we're going to come back to that. Before we do, Scott, this idea of, downshifting and 20 hours and having flexibility is often cited as a way of keeping people in the workforce while they go through the various seasons of their lives. So it'd be interesting to know, we know that Benefit Bump's mission is to keep women in the workplace. So, in addition to that, what trends are you seeing? What are employers doing to retain women, and also just in particular to combat burnout and the mental health crisis?
Yeah, no, it's a great question, and it is an exciting time. I do think that there's probably more focus on work-life balance from a sincere perspective than ever before. Also maybe a little bit more emphasis on kind of the flexibility and expectations of the modern worker. So examples of that we're seeing is expansion of paid parental leave. Organizations that are even creating unisex policies where men and women get the same time. Expansion into other paths to parenthood and making sure leaves are available there and treatments are available. But one of the things that we saw as a big gap, or really there are a couple gaps that we think are worth filling, is that I think that there's been a lot of emphasis on mental health treatment from a therapy perspective, but there's great research that really indicates that it's the situational stressors that are really driving poor mental health. But we're not spending a lot of time there, and so Benefit Bump really focuses on those situational stressors. How do we help folks find childcare? How do we help them interact with their partners, developing a postpartum plan, things like that. So what we find with a lot of our participants as they're trying to deal with this burnout is they're not looking for us to give them a referral or help them find a therapist as much as they want us to help them figure out how to get things done that improve their life. The other thing that's been really interesting, and I commend Moderna because they do amazing things and they have a really engaged population. But we did a study last year where we asked employers about this issue of flexibility and, phasing out returning to work. And it was pretty much about a quarter of companies actually have a formal policy that kind of guides the workforce and managers on what that flexibility is. And there were quite a few folks that said that they had informal approaches, but then we get to this, it's a term that somebody we know uses that I really like. Then you get to this manager lottery where maybe certain employees get the benefit of flexibility and others don't. But yeah, I think that there's been definitely an awakening around, balance and more holistic support as what the new, workers demanding and should be getting.
Scott, when you speak about that, it reminds me of this adage, people leave their jobs because of their managers. That's why, you can have the best policies in the world, but the way it sticks, lands, and feels is often dependent on, my manager and my relationship with that manager. And then what to do in that instance, I suppose.
Yeah, well, yeah. And I think what we're hearing a lot of employers now saying is maybe we need a little bit of training, so, especially for first-time managers or really most managers, they're not going to encounter this that often. And then what do they do? And I joke that I have a friend who was probably the first person I managed who had a baby, and I left a lot of room for improvement. I wished my company would have given me a little bit better guidance on how to be a supportive manager and, just some simple do's and don'ts. So.
We can all admit to that.
Yeah.
I have, similar admission. So, I mean, in these stories from Scott, both you and Katie, we're seeing these links between it's mental health, it's a situational context, it's my physical health. It also would be financial health, that all of these pieces are linked. And again, I go back to our data that, we have this member data showing that higher levels of stress are associated with 3 times higher rates of poor nutrition, 20% lower average step counts, and an hour less of sleep per night. So this is not theoretical. You can really see it playing out in the data. What we do know, though, is that the interdependence of these facets of health can therefore be turned around. And certainly what we've seen is if you move someone from inactive to active, you can have profound effects on other healthy behaviors like nutrition. So we saw a 16% increase in healthy food as a percentage of a shopping basket. We saw a 26% increase in preventative screening, which is obviously key, 43% increase in online assessment completion, and 80% increase in overall engagement with our program. And what we're finding is those same members that get more active then also happen to look after their finances better. So the interdependence of our health is key and has implications for how we think about benefits. And we touched on this briefly earlier. So Sarah, I was wondering if you can share with us, in your mind, to what degree and in what ways are the facets of women's health in particular interdependent? And then what does this mean for benefits design and provision?
Thanks so much for that great question, Tanya. I think all of these things are very connected. And when I was running the 32BJ Health Fund, it's exactly what led us to develop a first of its kind high value maternity network. We were a self-insured plan. We were paying for 1,200 births a year in New York City and northern New Jersey, and we weren't getting good outcomes. And we knew that birthing people were having a hard time finding the care that they wanted. We also saw enormous disparities between women of different races and ethnicities in our outcomes. And we knew that there was an opportunity for us to use our purchasing power to start to close those gaps. And so we went through a process where we identified a series of high quality facilities in northern New Jersey and New York. And we stood up in a program to incentivize but not require use of those facilities and providers amongst our members who are giving birth. Because they were both high quality and they just happened to be lower cost than a number of additional name brand hospitals in the region, we were able to pass through those savings to our plan participants. And so if you used one of the hospitals and you used our maternity program, prenatal care all the way through labor and delivery was going to cost you at most $40. We covered all of the testing fees, we covered all of the ultrasound fees, we covered the labor and delivery costs, and mom and baby would get a package of goodies just before delivery to help mom and baby through the birth. And it was enormously successful. What we heard from people, both birthing people and from their partners, was they really appreciated that we as a health fund cared about them enough to help them find high quality maternity care. And we made it easy to make the right choice to find high quality maternity care. We helped them get appointments when it was hard to get appointments, and even for someone who was late in their pregnancy. And we also heard that reducing financial costs, so at most $40 for the whole episode, was a real relief for people. We already had low costs, but knowing that people would be protected from surprise bills, that we would be on their side if anything went wrong, was enormous psychological and financial relief for people, knowing they could get high quality care. And we also found a range of providers. So if someone wanted an OB, if someone wanted a midwife, if someone wanted a doula at bedside, those were all available within the maternity network that we created. And so one of the things that was really important was we heard that people wanted different options. We weren't deciding what was best for people, but we were saying, here's the best of the bunch for you. You can pick the right path for you. And it was an incredibly successful program where we were using our purchasing power to improve the quality of care for women, improve the outcomes they were having, and reduce their costs as well as the plan cost. And we think there is enormous opportunity for other purchasers to leverage their purchasing power and do the same thing.
That is a crazy number, $40. I mean, it's incredible. What were the challenges in enrolling providers into this? How did you go about managing that?
I think what we saw, and our experience was in New York and New Jersey, it's probably similar in other geographies, is that we first issued an RFP to hospitals. You had to meet certain criteria to apply, and then we did in-person interviews to really make sure that they had the policies to back up the outcomes we were seeing in the data. And I think what we saw was there was really wide variation amongst health systems in their commitment to improving the quality of maternity care and their commitment in reducing racial and ethnic disparities. And I think that our ability to use our purchasing power to push all health systems in the right direction and handpick the ones who are really motivated to do the right thing by their patients was really powerful. I think there were other health systems that just weren't there yet, and we didn't include them in our network.
Right. It's the power of curation.
Yes.
And as you say, the purchasing power. Katie, it would be interesting to know what trends you have seen, either in terms of how maternity benefits have been handled, or in terms of the multi-dimensional facets of women's health and how that's been looked at Moderna.
Yeah, and I think Sarah brings up a really good point where, you have the physical part of family building, but the experience is completely tied to your mental health and your financial health as well, depending on cost. So what we've done, and we partner with Benefit Bump, as Scott alluded to, and part of that program offers care navigation for anyone looking to expand their family or access any sort of fertility benefits. And I think having them as kind of the initial go-to, aside from the benefits team and HR, of course, is a really important link, because it can kind of take the stress out of navigating the healthcare system, navigating costs or how you're trying to build your family, in addition to reminding people about some other benefits that we may have available to support them. In addition to that, we like to support kind of women and all kind of parents to be in all facets of the family building journey, and each type of family that is being built. So whether that's adoption and surrogacy and providing allowances so that people can build their families that way. We obviously provide low-cost medical plans to eliminate the financial barrier to having good health care. So it's such an interconnected link between the obvious benefits that you utilize for these types of events and journeys, but also the secondary ones as well that really kind of create the full package, and I think support our women the most.
And I mean, in that response, I'm hearing there are many dimensions to thinking about this and to driving uptake of benefits. So, the one is certainly in the case of this maternity program, the idea of the network, creating the network and making sure that it's well understood, the quality standards, the criteria, etc. when you are talking about this, the idea of the family and offering the right benefits for that. But what I hear both of you talking about is the idea of at some point you also have to reach the member. You can have very clever design and very clever programs, but then how do you make sure that that is heard, recognized, and acted on by a member? Close to our heart at Vitality, because we know that communication is so important, framing is so important, messaging is so important, but often not enough time and focus is spent on that, particularly when it comes to women. So what I wanted to share in kicking off a piece around messaging and framing is that we recently collaborated with behavioral scientist Hal Hirschfield, who's at UCLA. And what we were trying to understand is how best should we communicate to people to have the highest likelihood of them taking an interest in their health now and their health in the future. And this would be the idea that I have immediate events and I need to seek the best care. It should be high quality and low cost, but equally I should do things for myself now. Current me needs to do things for future me. And how do we make that message land and stick? So what we found is what we tell members, how we tell them, and who tells them has a massive likelihood on how likely they are to take action. We found 4 specific things. First of all, while people want to know forecasts of their future health, they'll only take action when that information is shared with them by someone they trust, which feels obvious and intuitive, but seeing it laid out in the data was interesting. Second of all, framing is critical. So what we saw consistently, and this was consistent across age groups, risk groups, gender, and race, predictions of when a person may die or the possible conditions that may occur in the future didn't resonate. What people wanted is they wanted future me contextualized in the present. And to do that, they needed like a risk-adjusted age versus the current age that says this is you versus the you think you are, and that resonated really well. Third, we found that messages framed in the positive resonated better than those in the negative. And this is interesting because the idea that people respond to negative news, we actually found that they became despondent rather than respondent. And finally, keeping it simple is best. So it'd be interesting to know, I'd be interested in the findings from this group, because again, one can have the best benefits in the world, but if they're not communicated properly, they're irrelevant. Scott, how do you communicate with members in a way that resonates? And does this differ for women versus men?
Yeah, so I think we're pretty lucky that, we focus on growing families, and growing families are info seekers, as evidenced by the hundreds of thousands or millions of websites that are built to support them. So typically we found that simple messaging around, us being there to support folks through this journey yields high enrollment. So like with Moderna, I think we have more participants than they have average births on a, employee population size adjusted basis, because we're also finding that a lot of people want help even before they start the process, get a sense for how their time off is going to work, how their benefit works, other considerations. And then just, kind of lightheartedly, our name helps because we're Benefit Bump, and I think people relate the bump. So we'll have participants tell us periodically that it was easy for them to figure out what we do. But for us, we haven't seen a tremendous difference between men and women in terms of how we get them to respond to us. It's more around how they respond to us, or how we respond, how they interact with us. So about 37% of our participants are men, which I think is also because we're focused on kind of the, what do you need to do, when do you need to do it, and then we help people get things done. So we don't kind of lean on the historical clinical model of supporting folks during pregnancy. We're really focused on the helping people get things done. And what we find is that, men a lot of times start off the interaction with us, focused on some of the technical items. How much is it going to cost? How do I save for it? How's my time off work, especially if they have parental leave, and, things like childcare. What our lead navigator reminds me of regularly is that our men are almost or just as likely to also tee up some of their emotional challenges through this, because they're going through this event with a spouse or partner. Maybe they've experienced prior losses. Maybe they're nervous about expectations, balance, things like that. For our female members, I think, the thing that really characterizes it is what role they're looking for us to play. So we lead with, mental health professionals as our navigators, but also almost all of our navigators are moms. And more often than not, I think our participants are leaning on our navigators as kind of that peer, that the party that's been through it with them or been through it before and can go with them on this journey as being a high priority. So I might have strayed from the original question, but I think it's a little bit of both. I think it's easy to find us, but then I think each participant has to then figure out how best to use, the resource we provide.
And it is interesting to see I remember when we chatted initially, I was surprised by the high rate of usage by men. And then I was kind of surprised that I was surprised, because it actually makes sense. Of course it makes sense. It takes two in a journey. But you also mentioned the idea of playing on the idea that a man becomes enrolled, once the baby arrives. That is when the man typically is then properly enrolled in this birth. And previously, this is a woman's journey. You mentioned it when we were prepping. If you could share a little more about how that looks and feels.
Yeah, so I like to believe that, pregnancy has become more of a we event. I think each year it gets progressively more so. So yeah, we see men engaged just as early. About a quarter of our calls are with couples, which is really helpful. We've started serving up a lot more content to help, men be supportive partners. So we call them bumpinars, so just regular interactions we have with our participants to educate them on things that we think are relevant. And we did one recently on super dads with an advocacy organization, just tips on how to be a good partner. We really encourage our male participants to work through a postpartum plan with us and their spouse, just to think about things like rest and feedings and, running family errands and just being more mindful than maybe they were, maybe would have been otherwise.
Just
so it's been
jump
exciting.
in. I think there's
Yes.
also an opportunity for us, to recognize that there are a number of women's health issues on the table, but that birthing can be something that's available to trans men as well. And that one of the opportunities is to really recognize and use inclusive language and make space and ensure that they're represented in birthing benefits and support systems as well.
Yeah, no, that's a great point.
It's so useful, Sarah. And I think it takes us to a point around how we think about men in the context of women's health. Because it can be quite narrow, women's health is something for women to think about and for women to do, when in fact, not only is the audience broader than women in many instances when we think about, events typically associated with women, but also the role of men in bringing better health to women. So I think let's turn our attention there. Earlier when we started, we spoke about the disparities facing women in the workplace, and especially with regards to mothers. And much of this is, of course, due to the unequal roles. Katie, you mentioned women as caregivers versus men. And whilst we're hearing plenty of progressive rhetoric in the workplace, the reality is there are stark differences between maternity and paternity leave, and these remain. And we see disparate support for men and women in terms of other benefits like fertility treatments, childcare support, the full spectrum. So I just wanted to pause here and think about how one could think about the role of men in creating equity. So maybe, Sarah, it'd be interesting to know from you, what patterns have you observed in terms of benefit uptake? What changes have you had to make with regards to benefits design and or selection to correct inequities? How do you see men playing a role here?
I think I'm going to focus that question on some opportunities going forward. I think particularly in this moment when abortion and reproductive rights have been threatened for women and other birthing people across the country so dramatically, I think the role for employers is to really think about what benefits are being provided to people with a capacity for a pregnancy, how you make those benefits and medical services available if they're in a state where they are not currently available. I think it's also a question about work assignments. What happens if there's a conference or a work assignment in Texas or Florida in a state where a pregnant person would need to travel and their medical needs could be jeopardized if something unexpected happens during that trip. And so I think that employers and, I think large Fortune 500 companies are disproportionately led by men. I think this is an opportunity for people to step up and use their voice, not just for benefits, but let's just be honest that a lot of these policies come through politics, and to think about the politics that they're influencing and to think about the politics that influence your workforce.
100% right. And it's, yes, complicated. And as you said, I like the framing of it as an opportunity, but one that is tricky, tough to tackle. Katie, it would be interesting to know from you, progressive employers are asking, well, how do we spot inequities in our current benefits design, and how do we enroll men? So can you share a little bit about how Moderna is thinking about that?
Yeah, I think one of the biggest things that we rolled out at Moderna was making sure that our bonding time for leave was equitable between birth parent and non-birth parent. And we've been trying to, as a global company, kind of fast track the things that we've done in the US outside the US, which has posed a whole other host of challenges. And it's also, to Sarah's point, kind of magnified the fact that there is a lot of training that needs to happen to make sure that the perception of not only kind of why we offer these leaves, but how long they are and what they're for are felt and understood throughout the organization globally. You know, obviously you can have these benefits out there, and as we've all discussed today, they're not perfectly at all times, you know, implemented and available, but it's our job to kind of make sure that managers are trained that when someone needs to go out on a parental leave, the same care for that person and the same forgiveness in terms of being away from work is given, whether you're the birth parent or the non-birth parent. And we've seen instances where that's not always the case, but we have to make sure that is the case on a global scale and across the board.
And just then pausing on that point and talking about making benefits realizable by members, I did want to ask you, and then switch topics, but I did want to ask you about communication, how you think about that and what you've learned.
Yeah, I think when it comes to communication, I mean, we get so far down into our benefits lens as you know, benefits nerds on a benefits team here. But what we kind of start with is looking at the data. So we have obviously claim data. We have so many different sources in terms of the partners that we work with, our vendors. We have actuals in terms of people taking time off, how they're using our benefits and all those good things. And it's helping us to kind of acknowledge what people need. So for some people, that's 18 weeks of paid time off to care for a little one. For other people, that's more childcare so that they can get back to work earlier than that because they want to come back. So if we're kind of approaching from that starting point, our communications, we can then work with our vendors to create a really holistic experience. As benefits people, we have kind of this one touch point at the start for communications. But if we work with all of our different vendors like Benefit Bump or healthcare providers or concierge service, pull them all in, make sure they all know the benefits that we offer so that when they hear from our employees, they can also do soft transfers. They can also educate and advocate for our employees. I think that makes communication a lot easier and can kind of build those links between everything that's offered to support.
I'm on mute. And to reduce that fragmentation that otherwise so easily occurs. Yeah, that makes a lot of sense. Scott, I want to turn to you and go back to this idea of men and women's health. You know, so it's unique. You're a man who founded a company that is perceived to focus on supporting women during pregnancy. So we've already debunked a lot of that now. It's not about just women. It's not about just during pregnancy, and it's not about like the clinical medical factors only that revolve around that process. But it'd be interesting to know how you landed here, how you think about men in terms of supporting women's health, which I think you've covered a little bit, but just, you know, anything else you want to share on that?
Yeah, I mean, I think it's a lot of what we've talked about around just how complex benefits are to navigate. So, you know, part of the original design was how do we actually unpack everything? Because if you look at most point solutions that exist in the market, they're focused on treatment. And treatment's just one part of the equation for most families. And you mentioned financial well-being recent in a prior comment, and we did a little research with an organization where we found that 47% of new and expectant parents are living month to month financially. 2/3 of families going to debt. So there are a lot of other complicating factors that have to be connected that, really we're missing. So part of it, I would say, is idealism. Part of it is maybe the room I left for improvement. As a father of 3 who I'd like to give myself grace that I was on the wrong side of this revolution. I think I might have had 3 parental leave days across 3 kids, and it was just a little bit more challenging. But I also missed a lot of cues, things that probably could have helped with the overall health of our family. And so yeah, I think my path is I'd love to see benefits delivered better. I'd love to see workplaces be kind of who they maybe idealize themselves to be on LinkedIn. I'd like to kind of actually see it happen in real life, like, what Moderna does. So
Yeah, bridging the gap between the should and the is.
Yeah.
Can often be one step too far. Thank you for that. I'm seeing that a question, I want to go to a question from the audience, and I'm remiss in saying, please do share your questions so that we can tackle them. This question says, how are employers thinking about changing or expanding their health benefits in context of Roe versus Wade? We've seen many employers introduce abortion-related benefits, but as we're seeing, this comes with both privacy concerns for employees and litigation concerns for employers. Have you seen any new approaches to benefits that cover the full scope of women's health care, including abortion care, while dealing with the privacy litigation concerns? So I'll open that up. I'm not sure please pop if you want to contribute.
So for Moderna, being a Massachusetts-based company, the mandates, even though we are a self-funded medical plan, the mandates in Massachusetts are very robust in terms of abortion care. So we managed and maintained those and made sure that we had the highest level of care available from that perspective, from a clinical perspective. And then in addition to that, we offer a lifestyle spending account, and we were able to tack on to that piece the ability to create a very private, separate account for anyone who perhaps needed to travel for services outside of their state where they're offered. So kind of eliminated any sort of privacy concerns that the employee may have had, while also still making sure that they got full coverage for travel and any sort of associated costs they may have, in addition to obviously providing the really robust clinical piece. Throughout all of this, worked very closely with our employment attorneys, of course. Their feedback on all of this, in addition to a lot of our benefits policies, is invaluable, we have found. So really appreciate working with them through this, but that has been our approach. And so far we've gotten some really positive feedback from our employees who are really grateful to have this level of support.
Absolutely right. Sarah and Scott, anything you want to contribute?
I mean, I would just add, I think, unfortunately, that the national debate focuses primarily on elective abortion for birth control purposes. But, as probably all of us know, and we see with our participants, there are a lot of other things that, have essentially become impacted. So, in our world, it's non-viable fetuses and how do folks navigate some of the tough decisions they were making before, where now they have more restrictive state laws that they have to balance, or folks who have completed, their family through fertility treatment, and now they have unused embryos that they need to figure out what to do with. And so, yeah, I think it will be great to see this discussion expanded beyond the politics into the practical and medical applications of this space.
Thank you. Perfect. I'm going to go, Sarah, to you, because this question was asked to you directly, but I'm not sure everyone had the benefit of reading your response. So the question is, Sarah, when you were creating a maternity network, did you consider wraparound services such as access to registered dietitians, healthy food services, or mental health professionals?
The things that's really unique about the 32 BJ Health Fund is that we worked really hard to make sure people could use all of their benefits. we didn't just wait for people to come to us and say, I'm having a hard time accessing my benefits. We regularly did outbound outreach to say, we want to make sure you have benefits you can use. We're here to help. And so some of the barriers that people find using insurance in other places, that can't find a behavioral health provider with availability or who speaks their language, or they don't know what's covered, we really eliminated those barriers. We had customer service representatives who offered services in multiple languages, evening hours, and we just did a ton of outreach, and we connected early and often with people who are pregnant to make sure that they were making full use of all of their benefits regardless of what they needed. It was very unique and really encourage other people to invest in those kinds of services.
That was going to be my question to you, Sarah. Are you aware of where else this is being done? Similar approaches?
I'm not. What I'll brag about is that the Health Fund has a net promoter score of almost 90%, which is unheard of for an insurance plan. And so, I see one of the next questions in the chat is, there can be behavioral health changes when people get information from a trusted resource. Who are the trusted resources? We can get to that question in a minute, but one of the things we worked really hard at was to be a trusted resource, to meet people where they were at, to help them with whatever they needed. And so we became a trusted resource. And so when we recommended a provider for care, when we stood up our maternity network, people really trusted us. They knew that we really vetted the clinical quality, patient satisfaction, and everything else that they would want to know. And so they really looked to us for guidance and recommendations.
That's very helpful and impressive. You're allowed to brag. That is truly impressive.
Thank you.
Let's pause on this point of trusted sources and what that looks like. I mean, I have a view on this from our research, but it'd be interesting to know, Catherine and Scott, from you, when we talk about trusted sources, what does that mean?
Yeah, I think for us, we have a really powerful employee resource group network at Moderna. And I think it's pretty well known that we work very closely with them as a benefits team, and therefore kind of gives us a little bit more credibility as a trusted source with our employees, because they are built by employees and they are giving us their feedback and are including us in their missions and things that they need and may be looking for. So I think the voices of our employees are probably the most valuable asset we have as an employer and as a benefits team. And I think if we can really make sure that we're listening and they are heard, then we ourselves can become that trusted resource.
I think and it speaks well to this idea of the power of social, the power of an influence of my peer group. Whatever that looks like. Certainly I can say what we've seen at Vitality is the clients that we have that are most successful in driving engagement in health have a heavy focus on leadership, which we've touched on, but also on champ networks. And so this is the idea that local champions, whether it's, in a factory, a plant, an investment bank, whatever that looks like, it's people like me. Say this is okay, say this is right, and are doing it. So we've certainly seen that has been a really big lever in terms of, I trust that this is right for me and I trust the source of information where this comes from. We've also found just more broadly, certainly the idea of a doctor, my primary care physician, that still lives as a primary point and source of trust. And that obviously has implications for, how often do I see them? Is it easy to access them? Telemedicine and all that. But certainly we saw that was a big source of where I will go to for advice. Scott, you were going to chip in.
Yeah, I was going to kind of take the flip side of that, which is, where maybe trust is a little bit lacking. And unfortunately, I think when it comes to growing families, there's still some meaningful level of apprehension about having these conversations with, your manager or even sometimes your HR team. And so I think that, for us, one of the things that's really important is to be that, neutral external party. Because I sometimes will hear folks say, well, isn't this what HR should do? We should talk to them about their benefits and their resources. But it's more complicated than that. And it, Tanya, probably goes back to your comment about managers as well, is, it takes a little while to establish trust, and in an environment where the results maybe don't suggest that it's clear and apparent, I think that becomes an issue.
100% right. And certainly we've seen some polarization around, it was not our poll, but we saw a poll around I trust my employer, and the idea that there's big polarization, and it comes down to my direct manager, and then also obviously how aligned what I see and feel on a daily basis. How does that sound relative to, as you said, Scott, the LinkedIn, the advertised version of the company, and the dissonance between that? So I don't think I'm seeing other questions in the chat. So what I'd like to ask the panelists, just by way of wrapping up, it'd be interesting to hear your parting thoughts in terms of things in particular that employers and health plans in particular, what should they be considering when we're thinking about benefits equity, when we're thinking about spotting inequity? Any concluding thoughts that you would have?
Well, I don't mind going first. I've been speaking about this for a long time. I just think we need a fresh look at benefits. I had a friend who shared with me that one of his clients made a realization that like their benefit plan is really designed for middle-aged men. And arguably, I think you could probably say it's middle-aged, middle or upper income men. And so I think it's time for us to rethink how we deliver benefits so they truly benefit others. I was going to make a comment to the men out there, just in terms of the value of being supportive. So I was looking at studies because, as I admitted on LinkedIn, I was a little nervous, maybe being a representative, and maybe not, I don't know. I won't say not the best choice, but hopefully a good choice. But there's a lot of really good evidence around the role that the non-birth parent has in outcomes. And so prenatal stress and anxiety are a key driver of poor outcomes. Better paternal support leads to lower levels of stress and anxiety for mom. Supportive dads actually are correlated with better rates of prenatal care and better breastfeeding support, so more breastfeeding success. And then, maybe tongue in cheek, because sometimes men are a little more self-centered than the other gender. There is a study that shows that parental bonding or paternal bonding actually helps improve our lifetime health. So help them, help us. Oh, no, but I say that tongue in cheek, but there's really good evidence that parental bonding is good for mom, dad, and baby. And I think that sometimes us men forget that this is really good for our health as well. So
appreciate that. Thank you. Katie, you look like you're off mute.
Yes. Scott, yes to everything you just said. Our philosophy at Moderna for benefits is to ultimately flip it on its head and really change the world of benefits and how we're approaching it for our employees. And when it comes to women's health, we want it to be out there as a human health issue and really bring this into our discussions regularly so that we're catering to the person listening, whether that is the woman, whether it's the spouse, whether it's the father of a daughter, whoever it may be. And so we're working very hard to make sure that our messaging is right, our communications are right, our links between our benefits are culturally appropriate and are transitioning the way we want them to transition. But I think parity is really going to start with training. We can have, and I said it earlier on, we can have the most robust and inclusive and equitable benefits plans out there, but if they're not implemented that way and understood that way, then it's not going to happen. So I think that's the key to all of this. And Scott, Sarah, Tanya, I have so appreciated this conversation today and speaking with you all. It's been wonderful. So thank you.
Thank you. Sarah.
Yeah, I think what comes to mind for me is that a lot of benefit design in this space is a response to inadequate public policy. So for example, if you are an employer who has lower wage employees, you probably have people who are Medicaid eligible, but a number of states haven't expanded Medicaid or don't have Medicaid 12 months postpartum. Those employees can't afford your health plan. So I think it's an area where employers really have to raise their voice in a policy forum and think about benefits beyond what's provided in a benefits package to ensure equitable access to care.
And that was absolutely what came through so strongly in that Bloomberg article. The idea that there are these inadequacies, and then it falls to employers to address those. And I think, as you point out, the role of employers being twofold. One is make this work for employees and figure out the ways to make it work. But second is use a voice that is prominent to influence policy and public debate, which is critical. So I was going to say a similar thing exactly to that, Sarah. It's a broader thing than just, again, the benefits design. It's broader than just how one communicates. It's broader than just thinking about how these interweave together. It's also about thinking, taking a step back and saying contextually what is going on here, and what are the drivers of why we find ourselves compelled to offer this or not, or compelled to find that this doesn't work and creates inequity for these reasons. And so a really kind of thoughtful approach. So I really want to say thank you. Thank you to you all, Katie, Sarah, and Scott, for sharing your perspectives. I think you've added tremendous value, some surprising insights, but also I think some pragmatic guidance on how we can tackle some of these issues. And again, then the conversation, I think, to walk away with some questions around, are we thoughtfully considering the gender inequities lurking in the health and benefits plans? How are we doing a critical review? And I think, to Katie's point, how are we being data driven to say, what is the impact of the benefits we offer and how does it need to be targeted and segmented for different groups of employees? So thank you again. A big thank you to our audience. We know you have limited time and we're very happy that you chose to spend it with us. And please do reach out for more information, or if you have other thoughts or questions after this, with pleasure, reach out and we'll be in touch. Thank you again and have a wonderful afternoon.
Thank you.
Thank you to Tanya and all of our speakers. Please visit our website at hlth.com to catch up on all Health Go Live webinars. And join us in Las Vegas, November 13th through 16th for Health 2022.